This video is about the elderly mobility scale, EMS. Purpose of the EMS is to provide a scale for the assessment of mobility, considering locomotion, balancing, and key position change. The function reaches components as well as the whole EMS can predict an individual who is at risk of the falling, because we know the old people got falling is maybe it's danger. If they hurt the hip or some location, mostly they will die after 1 years. Description: the older mobility scale is a 20-point variable assessment tools for the assessment for the frail elder subjects. EMS is an ordinal scale measurement. This test is appropriate for elder patients in a hospital setting once the acute medical condition has resolved, or as outpatient in day hospital environment. Here is a chart of the elder mobility scale scores. We can see the tests include the lying to sitting. The point is it depends on they need help or not. Sitting to lying, the same like the last one. Sitting to standing. In this one, we can see we need to count the second. If they can do it by themselves, under 3 seconds or more than 3 seconds, they can get 3 or 2 points. If they need help, they only can get 1 point or 0. The standing we still need to test. Standing without support is 3 points. And able to reach got 3 points. If standing without support but need support to reach is 2 points. 1 point for stand but need the support, and 0 point only with physical support or another person. We can see the gait have the different point too. Counting the walking is the important part in here. The 6 meter just for the old people. Under 50 seconds is normal for 3 points. 16 to 30 we give 2 points. Over 13 is 1 point. If they can't finish this, they will get 0. Function reach. 4 points over 20 cm. 2 points 10 to 20 cm. 0 point under 10 cm. So after the chat, we can see for this test we need some equipment, like a stopwatch, metal rules, access for the bed and chair using walking location. And the time is almost for 15 minutes to do. Space, we need the location have a chair and a bed, and the location can walk for 6 meters. So it's good to use for consider function has clinical and person significance. Little training necessary tests for both leg power and strengths, as both as assessment tools and outcome measure with the appropriate patient. But this test still have some limitation too. In commonly environment, 6 meter is not often available. Function reaches distance in considers with original function reaches test. Ceiling effect achieves quickly for those recovery from an acute illness or who are more able, not a very sensitive tools for people with issue of the poor confidence.